Thank you, sir. A very good evening to all of you. So we'll be starting with this IC on management of unusual traumatic cataracts. And here we have with us some renowned speakers. We have Dr. Manish Saxena. He's the owner of Shankara Karthik at Kanpur, and he's a renowned vitreoretinal surgeon and a very meticulous and a very patient surgeon. Also, we have with us Dr. Abhishek Dikshit. He's also a very renowned vitreoretinal surgeon from Varanasi, Kashi Netralaya, and his surgical skills are excellent. Still to join us, Dr. Sudhir Srivastava, sir, and I hope that he will soon join us. We would not, Dr. Dilpreet Singh is also one of the panelists, but unfortunately he will not be with us today because his father is not keeping well. So, so he has excused himself from this meeting. So we will miss him. Dr. Sudhir Srivastava, I think he is on his way. He's also a renowned cataract and refractive surgeon from Lucknow, Sun Eye Hospital. He's the owner of that hospital, and he has some wonderful videos. Should we start?
Yeah, I think it's 1 p.m.
Yeah, we can start.
Okay.
You can call the first speaker.
Okay, so ocular trauma is a relatively common entity, and about 1/5 of the population will experience this injury sometime or the other. It's more common in young adults, and the WHO has estimated that there are around 55 million eyes who have ocular injuries annually, and around 1.6 million cases they land up into blindness with this injury. So it's a very dreadful injury, and in developed nations like ours, it's the most cause of unilateral blindness. So it's a really we have to be really concerned of this entity. In our IC, we will be discussing about the management of these unusual traumatic cases. We would be discussing about the pre-surgical consideration, the evaluation, and the assessment of these cases, how to go about doing the biometry, the challenges, and how to overcome them. And also we will be dealing with the traumatic iridodialysis, how to repair it, and how to give the best results functionally as well as cosmetically. Also, we will be dealing on the vitreoretinal aspect as to how to manage the subluxated traumatic cases, using this sparse planar approach. And finally, we will touch on the role of toric IOLs in managing these post-traumatic astigmatic cases. So to begin with our first talk, we have with us Dr. Abhishek Dikshit, and he will be talking on the entry with caution, pre-surgical consideration. And as I've already mentioned, he's a vitreoretinal surgeon from Varanasi. So over to you, Dr. Abhishek.